Well, February is American Heart Month, and one thing that women really need to know that many don't is heart disease is by far the #1 killer of women.
It kills 10 times more women than breast cancer. Today, there are new tests you can get to help gauge your risk of a heart attack, even if you don't have any symptoms.
We went to Central Connecticut Cardiologists in Hartford to learn how heart disease is different for women.
First symptoms were just shortness of breath, which I really hadn't experienced.
DONNA AINSWORTH was only 50 years old when her massive heart attack struck. But at first, she didn't seek help until...
On the third day, it was literally like a cinder block was on my chest.
That's when her husband made her go to the hospital. But even then, initial tests didn't reveal anything wrong. They were about to send her home.
Thank God for my husband. He piped up and he said, you know, I think she should have a stress test. You know, we're here. Her mother had 4 bypasses at 46. You know, there's something wrong.
So your husband knew, but as a woman, were you dismissing it?
Well, I think there is a little denial. Sure.
DONNA ended up having a quadruple bypass surgery. Dr. Timothy GLEW, a cardiologist with Central Connecticut Cardiologists in Hartford, says he sees stories like DONNA's all the time.
It's very common for women to have treatment delays because they don't recognize the signs of heart disease as a man would.
That's because often women don't see themselves as being at risk.
It's the #1 killer by far. The statistics are 1 in 3 women die of heart disease. Breast cancer, by comparison, is 1 in 31 women.
But there are new tests that really we can be getting that can make a big difference?
Yes, we've moved beyond just trying to identify risk factors, and now we're really trying to identify heart disease, especially in women, because some of the risk factors may be atypical.
A new non-invasive test could be a lifesaver.
So there's a new test called a coronary artery calcium score, which is a test you can ask your doctor about. It's a low radiation CAT scan, and it actually looks at the arteries of the heart and picks up calcium, which is a marker of atherosclerotic heart disease, and it will give you a score.
The good news is, if you have a high score, doctors have many treatment options to help prevent a heart attack. Here's what heart disease looks like.
So heart disease is buildup inside the arteries of the heart. So we're talking about the arteries that course on the outside of the heart here. We're talking about blockages in these arteries, okay? And if an artery gets totally blocked and there's no blood flow to the heart muscle, that's called a heart attack.
But for women, heart attacks can feel different. Dr. Kathleen Kennedy is also a cardiologist here at the Central Connecticut Cardiologist Prompt Center. She's checking in on DONNA.
We feel that about 80% of heart disease is potentially preventable, and that people should be screened, and screened early, particularly with a family history.
Dr. Kennedy wants women to get educated about the signs and symptoms of a heart attack.
The softer signs, about 20% of people will have shortness of breath or unexplained shortness of breath when they're doing things. You know, I'm usually pretty active, I exercise regularly, but now I'm noticing I go just up the hill and I'm catching my breath or need to stop when I climb 1 flight of stairs. Other symptoms could be unexplained drenching sweats, palpitations, also exceptional fatigue that shouldn't be there, unexplained fatigue. You know, a lot of women will describe their heart attacks as feeling like a quote-unquote indigestion, which is more of a burning or a heavy feeling in the chest, but it is discomfort in their chest.
Dr. Kennedy says women need to know their risk factors. Obesity, diabetes, smoking, high blood pressure, high cholesterol, and a family history of heart disease are all risks for both men and women, but
there are sex-specific risk factors for a woman that are important. If a woman had an early menopause, and we identify that as younger than the age of 40 years old, that would be a risk factor for heart disease. Also, if a woman had a pregnancy-related high blood pressure or pregnancy-related diabetes, that's a risk factor for heart disease later on in age. One of the points I try to make to my female patients who have risk factors is that if you would be telling your husband to go see the doctor or to call 911, you should be doing the exact same thing.
9 years after DONNA's heart attack, she wants others to learn from her experience.
You really have to be your own advocate and know how you feel, know when something's a little off. You know, women are the symptoms are so subtle.
Right, so I hope you were all listening, because again, the new test we spoke about is open for everyone. It's just a CT scan for your heart, so it's like an easy x-ray just to give you that coronary artery calcium score. It's under $100, and you can get it from your doctor, or just schedule an appointment with the doctors that you just met at Central Connecticut Cardiologist in Hartford.
And they're going to be holding a free screening day soon for veterans and teachers, so stay tuned for that.
Yeah, they also have a prompt center, which is like an urgent care for your heart, so you can skip the ER and get seen by a cardiologist right away. You can learn more at ctcardiology.com.